Hello everyone, myself Barsha Roy. Currently, I am pursuing my Bachelor's of Physiotherapy degree from Marwadi University, Rajkot. So, in this video, we are going to talk about a disease called Andaman haemorrhagic fever. This title shows the severity of the disease and turning the scientific name into a story of its impact. We will see why this disease is named as Andaman haemorrhagic fever later on. So, let's start with the introduction. So, leptospirosis. It is a bacteria disease caused by bacteria leptospira, which can affect both humans and the animals, including dogs, rodents, and other domestic and wild animals. Approx 1 million severe cases occurs globally, in which 50 to 60,000 of deaths occur worldwide annually, and the severe cases accounts for 5 to 15% of all leptospirosis cases, and this is most common in tropical and the subtropical areas. This disease, the severe form, this leptospirosis, also known as Wills disease, if it is not managed on a time, it can be a life-threatening case. So, the leptospirosis, sometimes it is called Andaman haemorrhagic fever because the severe outbreak of this disease was first recognized in the Andaman Islands. So, the patient of that island was showing the symptom like high fever and the bleeding symptoms. So, let's start with the causative agent. So, leptospirosis, which is caused by a bacteria called Leptospira, the genus of spiral-shaped bacteria known as spirochetes. This is most common. The most common pathogenic variant of this bacteria is Leptospira enteroorgans. The properties of this bacteria: this is a gram-negative spiral-shaped bacterium which is anaerobic in nature and it is highly motile, processes through the periplasmic flagella, and this bacteria survives in moist environments such as water and the soil, and seen in dark under the microscope. So, mode of infection of this disease: infected animal urine, by which the water and soil get contaminated with the bacteria, and the person if the person is get in contact with the contaminated water and soil, the bacteria enter through the skin, the broken skin and the mucosal membrane. It enters to bloodstream and it spread to other organs and causes the leptospirosis. The next is pathogenesis. After contact with the contaminated water and soil, the bacteria enters through the broken skin and the mucosal membrane. It enters through the bloodstream and attaches to the blood vessels, wall of the blood vessels and other tissues, and the inflammatory response happens. To fight against the bacteria, inflammatory responses are going on, but these bacteria are survive that inflammatory response, and it reach to the multiple organ via the blood, and it causes liver damage, kidney damage and lung involvement, and causes the multi-organ damage. The symptoms of leptospirosis, we can divide this disease into two phases: acute phase and the immune phase. In acute phase, the headache, fever, vomiting, pancreatitis, the inflammation of the pancreas, muscle pain, diarrhea, abdominal and vomiting. But this can be treated if this is treated earlier. These symptoms can be subsided by the medicines. But if this acute phase is not treated by any medicine, that it can lead to the immune phase. Like when the immune system get involved in this disease, then it can lead to meningitis, inflammation in the brain, lungs bleeding, pulmonary hemorrhage, myocarditis, but it is very rare, liver failure, stomach bleeding, kidney failure, and the bruises. The risk factor of the leptospirosis: exposure to the contaminated water and soil, because the bacteria is already there in the water and soil, and the patient get contact with that water and soil, they will develop this disease. And then urine with the contact with the urine of the animals, especially the rats. Rats are very harmful, like a good carrier for this bacteria. Then occupational exposure, like farmers, sewage system workers, or the veterinarians, they are always with the water, soil, and the animals. So they are more prone to develop this disease. Then last one is recreational activities in contaminated water, like in swimming, river rafting. If the water is contaminated, the person who is doing those activities, they can develop this disease. And the complications of leptospirosis, it can like kidney failure, liver failure, meningitis, lung hemorrhage, heart inflammation, the multi-organ damage, and if it is reached the severe form, which is Wills disease, it can lead to death also. So, prevention of leptospirosis, improving the housing, sanitation, and infrastructure can help to reduce the risk of this disease and reduce the exposure to the flood water and contaminated water. After a heavy rainfall, the people should be reduce their exposure to that water and control the rodent, especially the mice, which is a good carrier for this disease or the bacteria. Use the protective equipment when the workers like farmers, like sewage workers or veterinarians are in the work, then they should use some protective equipment which can help them to get protected from the bacteria. Then vaccinating the domestic animal, when during the vaccination of the domestic animal, the doctors should be aware, be protective from the bacteria and disinfect the water bodies and the sewage system and the soil, which can help to prevent this bacteria, and prevention is better than cure always. Treatment of leptospirosis. This bacteria for mild cases, or the first line of drug for the mild cases of this disease is digoxin, and the azithromycin can be used as a alternative for mild cases when the bacteria develop to resistance to the digoxin, and amoxicillin and ampicillin, which is used in children and pregnant women if they develop this disease, and penicillin G. It is helpful in the severe cases, and the cetotaxime, which is very effective for this disease. And physiotherapy management for leptospirosis, we can help the patient with breathing exercise, because as we see that this disease involves the lung involvement, so we can help that person with the breathing exercises, the postural drainage, and the strengthening exercise to improve the muscle strength and the mobility, and functional training that will help the patient to walk and do the daily activities. So this is my reference. With this, we are done with the disease Andaman hemorrhagic fever. Thank you.